Hello, my name is Christina Herrin and Director of Free to Choose Medicine at the Heartland Institute. Today we welcome Dr. Joseph Brewer, an infectious disease specialist out of Kansas City, Missouri, for an exclusive interview. Thank you so much for talking with us today, Dr. Brewer.
You're welcome.
As a medical professional, what are some of the regulatory hurdles that have gotten in the way of treating patients with COVID-19, and how are doctors navigating treating patients?
Well, as you probably read in the press and seen on TV and so forth over the last probably 3+ months, hydroxychloroquine has been a extreme roller coaster. First of all, the drug has been on the market since 1955. It's been used extensively for many various conditions, and so using it for COVID-19, once there was data out there that it may be effective, seemed to be fairly easy and straightforward, but it has not been easy and straightforward. Regulatory bodies like the FDA got involved, which is curious because this drug is so old and been used so extensively, and we use many drugs off label. It's curious. So there were the FDA concerns, and then concerns on even pharmacies filling prescriptions. We had problems early on with pharmacies that would not fill prescriptions. And then there was concerns that there wouldn't be enough of it. So at the point in time that there was pretty good evidence it was working early on, there was concern that manufacturers wouldn't be able to make enough of it, and then patients who are already on hydroxychloroquine, say lupus or rheumatoid arthritis patients, wouldn't be able to get it. And then there became issues with hospitals. Hospitals like ours have these so-called order sets for treating diseases, and physicians that are not widely aware of using, say, hydroxychloroquine for COVID-19 would just follow the standard order set. So then there were directives by hospitals about exactly how it could be used. And for example, in our hospital now, it's completely off the order set. It's you can still pick it independently, but it's not. You just can't just check a box and prescribe it.
Okay. Well, that's really interesting that you mentioned off-label use. I want to dig a little deeper into that. So how common is it for just a general practitioner to prescribe any drug off-label? I mean, is that a very common practice? And why is the FDA so adamant or vocal against prescribing hydroxychloroquine off-label? What makes hydroxychloroquine so different? And, what do you have to say about that?
Well, for the latter part of your question, I don't know. I do not for the life of me understand what the FDA's agenda could be. They've sort of hidden behind this thing of toxicity, but there's extensive studies out there. And again, the drug's been on the market since 1955 and been taken by probably several million patients. So if we don't know the toxicity by now, we probably have been misusing it. We in medicine have been misusing it. In terms of off-label use, that's extremely common. There was a study published a few years ago that, and it may be more so now, but a study published a few years ago showed that approximately 20% of all prescriptions were off-label use of medications. In my particular specialty of infectious diseases, which is often involved with antibiotics and antivirals and things like that, we very commonly use drugs off-label. I mean, it's, for example, an antibiotic will come out indicated for just skin infections, and within 6 months to a year, we're using it for pneumonia and bone infections and other things. So my partners and I have jokingly said that we may use 50 to 75% of our treatments, particularly in hospitalized patients, are off-label. So it's very common to use drugs off-label, and even more so in our specialty, because look at COVID-19. This is totally new. We've never seen it before. We didn't know how to handle it, and so using drugs off-label would be the only way you could. There is no approved drug for COVID-19, and so everything that you use would be off-label.
Yeah, I think that's a really good point. And also, why is it so important that government needs to step aside in this instance and let doctors and patients have the right to choose? I mean, what's at stake here? We have millions of lives and personal choice at stake.
Yeah, and you may remember early on, I think the commissioner of the FDA actually said that a doctor should be able to sit down with their patient and discuss the risks and benefits. And that was before they did the first emergency use authorization. And I thought that was spot on. I mean, a doctor ought to be able to sit down with their patient and say, okay, here's what I'm going to recommend. Here's the pros, here's the cons, here's the potential side effects, etc. And then between the two of us, you and I can choose. And that's the way it's been in medicine forever. A physician and patient should have that relationship. And to have higher authorities seemingly trying to take that away is just insane. And patients don't like it either. Patients get very angry. They say, the patients will tell me repeatedly, why are you being restricted from, which I'm not, I prescribe it regularly, but why are there attempts to restrict it? And the answer is, I don't know that it's really clear, at least to me. It's obviously it's very political.
Sure. And I mean, you mentioned there is no vaccine or cure for treating COVID-19. And so, I mean, I would suspect looking to future treatment, there's new research coming out weekly, and there are going to be more trials and tribulations with this virus and attempting to treat it. What can government and biopharmaceutical companies do to help doctors and patients make decisions regarding their health care? And do you see any future problems with our current regulatory system that need to be addressed?
Oh, I think there's going to be lots of road bumps ahead. There always are. I'm old enough. I went through this with HIV and AIDS, and we went through a similar thing with new drugs coming out, and some of them hadn't been studied very extensively. And so, we've been through this before, not only in medicine, but in my specialty. And so I think new drug development's important. And the development of guidelines for monitoring and so forth is going to be important. But unfortunately, one of my colleagues said, this is like going to war, and we have to go to war with the tools that we have, not the tools that we hope we have. And so we have to use the tools that we have right now. We can hope for the future and new drugs and vaccine development and so forth, but we have to use the tools we have. And people are getting sick every day and dying every day, and there's a lot of information that drugs like hydroxychloroquine can be extremely effective.
Right. Well, thank you for that information. And do you have any final thoughts for our viewers regarding COVID-19, hydroxychloroquine, or the regulatory body?
Well, I think the big item is to discuss it with their doctor. Unfortunately, a lot of doctors, I'll just put it bluntly, a lot of doctors, particularly not aware of all of the details of it, like people are in my specialty, are frankly afraid to prescribe it. They're afraid of backlash to prescribe it, and that it shouldn't be that way. A physician ought to be able to sit down and look the patient in the eye, often these days on video appointments, but talk to their patient and say, this is what I would recommend. And this whole interaction of the patient being able to, or I'm sorry, the physician being able to decide with their patient in a one-on-one conversation, as I've done several times in the past week, has been lost. And it's tragic. It's like the title of your group. It's the freedom to choose for the physician and the patient, and that should not be encumbered. If this were some toxic, terrible drug that were horrible and had just been on the market for 6 months, that's a different story. But that's not the case here. This drug's been out forever.
Right. Well, thank you so much for your time and talking with me today, and I really appreciate your insight on this issue.
Okay, Christina, thank you very much.
Thanks for watching this video. please subscribe to our channel and consider donating to the Heartland Institute to support more vibrant free markets, greater individual liberties, and more videos like this one.